We're getting all of these whispers. Sometimes we're getting shouts from our body and we're just maybe ignoring them or being told that they're just part of aging or they're part of being a woman or just being a mom or all these different things. And you're like, no, they're not. They're actually signals that there's something else going on. And when we put these pieces together, you can feel better as you age. I feel better now than I did 20 years ago. So it is possible. It's just really looking at it from the right perspective.
I think one of the really big take-home messages is to come from a place of knowing that our bodies are not designed to decline as we age. In the functional medicine space or in the natural practitioner space, we have a knowing that these signs of typical aging are not signs of typical aging. They're signs of our health declining, and it's because of something that we're doing too much of or not enough of. Just start to take a pulse on these symptoms. So we don't have to overcomplicate it. It's just starting to understand that if you feel foggy in your brain, there's probably something that you put in your body that contributes to that. All right, ladies, really excited for you guys to dive into this one. In this episode, I interviewed Dr. Meg Mill. She is a functional medicine practitioner with a background in pharmacology. This is a super interesting conversation because she takes her information and education from pharmacology, understanding how the systems of the body work as a whole from her functional medicine background, and talks about a topic I have never heard a lot of information on before. It's histamine. And histamine may actually be a huge cause of some of the symptoms that you're experiencing: headaches, chronic fatigue, brain fog, joint pain, so many things that we could possibly be attributing to perimenopause or our cycles or just a result of aging, and they don't have to be. This was such a fun conversation. You're going to walk away with so many tools, tangible tips that you can implement today. Welcome, Dr. Meg Mill. I am so looking forward to this conversation all about a topic I have never brought up on this podcast that could probably be impacting so many women and perhaps their loved ones or people in their lives: histamines. Thank you so much for being here.
Thank you so much for having me.
Yes. So I did a little recon and background work, I've seen your stuff and my interest was piqued. I was Instagram stalking you for a little while. I'm like, what is all this? A new cause of symptoms that so many women are experiencing, from anxiety, brain fog, swollen, fatigue, all the things. And I don't feel like I, at least, have ever heard this talked about as a trigger. So I know we're going to talk about some really important information that women might not be looking at. These things are symptoms that I think many women just think is a part of aging or maybe fluctuating hormones. So this is very near and dear to my heart. So let's just dive right in. I would love to hear kind of where you got started. I think a lot of times this comes from a personal story.
Mhm.
So I'm curious if you were experiencing some of these symptoms and maybe also weren't looking at histamines as a potential cause.
Yes, and I think what's really interesting, and we'll dive into this, is how connected this is to all of these different symptoms. And when we're looking at the body, we need to look at the body as a whole rather than segmented. So I think in our conventional system, we're segmenting care. And you can see why. If you're having heart surgery, you want that heart surgeon to be really focusing on the heart, know everything about it, and that's their specialty. But when we're really starting to look at the whole person, at some of these full body symptoms, we need to look at what's connecting to each other. And sometimes we're not putting those pieces together. So we'll dive into that. But before we do, I'd love to share a little bit about my story, because I think it is, a lot of us have these personal journeys. And so I graduated, I actually did a full career change because I graduated with a doctorate in pharmacy. So I then went on to do a residency. I was a clinical pharmacist for many years, and I was also having some of my own health issues. So I was kind of looking at this in two places. In my professional world, I'm putting people on more medication. I know the protocols, I know why we're doing it, all the studies, and I'm seeing people really just surviving, not thriving, where we're saying, okay, we're on a different med. Okay, now you need to be on this med. And yeah, you're alive and we're managing this, but what are we doing to help you actually get better? And it's frustrating when you start to see this in the way it's kind of being done. At the same time, I was having some of my own personal health issues. So I was having a lot of GI symptoms. I was starting to get anxiety. I had allergies. I was reacting to things. I was having trouble sleeping. I was having a lot of different symptoms. And I was getting no answers. So I would go to different gastroenterologists and think, okay, someone's going to give me the answers. And I'm getting this like, you're fine, you're young, you're healthy. And you're like, yeah, but I don't feel fine. Like
Right.
what's wrong when I'm coming to you and you're saying like everything is good and I feel nothing but good. I can't eat. Like what I don't know what I'm going to react to. It becomes a cycle of like you never know. I think that's the biggest thing. You don't know what the triggers are. You don't know what you're going to react to. And it's this like fear in some way. A lot of people I work with start to get this fear of your health and what's going on and when you're going to have reactions. So I was going through a lot of these cycles. And I do remember sitting there, when my kids were really little, we took a trip to the beach and I'm sitting on the beach and I'm seeing them like run around. It's a beautiful day. They're playing and I'm feeling so terrible that I'm only able to focus on how I feel, on my health, and I'm feeling like so detached. And it just was, it's disheartening. You're just like, I want to be here. I want to be present and absorbing this moment. And I can't because I feel so bad and I'm detached from being here. I'm just sort of watching things happen. And so that was sort of a pivotal moment for me where I'm like, I need to make some changes. I know that that there are answers and I just need to find them. And I'm a researcher by nature. So I like dive in and read everything and research. So I started doing a lot of research and I started to help myself and I started to find answers and I found answers through functional medicine. And then I realized, okay, I feel so different. This has made such a health transformation in my life that I need to really consider sharing this with more people. So I actually left the profession of pharmacy, went back and got certified in functional medicine, and then opened my own functional medicine practice where I actually see people all over the world. So I've been able to help hundreds of people really have these health transformations where we're saying, and you and I were talking, and you were using the word whispers. We're getting all of these whispers. Sometimes we're getting shouts from our body, and we're just maybe ignoring them or being told that they're just part of aging or they're part of being a woman or just being a mom or all these different things. And you're like, no, they're not. They're actually signals that there's something else going on. And when we put these pieces together, you can feel better as you age. I feel better now than I did 20 years ago. So it is possible. It's just really looking at it from the right perspective.
So much there. I mean, I love your brain. I'm really excited to pick it in this episode because so many things. I mean, it's incredible when someone comes from a personal story because what you get when you get someone that has a personal story is a commitment to
Mhm.
like go to the ends of the earth to get answers to this. So we're very excited to get to hear this from you. And then you take your pharmacology background and like the way that you've been trained to see the body now as a functional medicine practitioner and looking at the root causes with the understanding of a lot of the biochemistry, either from the outside in things that people take, drugs, aspirins over the counter things, antacids, which I want to talk about as
Mhm.
it relates to
Yes.
anxiety. We're going to talk about that. But, you take someone's brain like this and we can just really geek out on the information, but most importantly, give these women like tangible information that helps them understand how powerful this is in changing the way that they feel and show up for the kids. I think so many of us women have had those moments where we're like there with our loved ones, but we're not fully there
Mhm.
because we either are exhausted or frustrated or anxious or depressed. So this is so applicable to so many people. And I'm already thinking about loved ones that I can't wait to share this information with. So tell us now, like more about what, as you dove in, like what did you start to learn and uncover during your path for your personal health as it relates to gut health and histamine? Maybe even like what is histamine, I think is really important to talk about.
Mhm. Yeah, so we need to really bring the body back into balance. I think that's one of the biggest keys is your body has a balance, a homeostasis, and we need to get it back there. So histamine itself is what we call a biogenic amine. So it's a part of your immune system. And when your immune system detects a threat or an allergen, an invader, histamine is primarily released from your mast cells and your basophils as part of your immune response. So you have two different parts of your immune system. You have your innate immune system, which is just ready to go. It's like the front line and it's going to attack whatever it sees. And then you have your adaptive immune system, which kind of comes in later and it tags specific things. So mast cells are part of this innate immune system. So they see an invader and they're like, okay, wait, we got to go get this. And so you have certain things happen in your body on purpose because we're trying to defend. So we help defend against pathogens. Histamine can also regulate stomach acid secretions, which, you mentioned the stomach acid and things like that. So it affects digestion. There are actually 4 different types of histamine receptors in the body. So it actually affects your neurotransmitters, and it can affect serotonin, norepinephrine, acetylcholine. So it can affect your wakefulness, your alertness, your cognitive function, your brain, your mood. It's involved in our allergic responses, which is what most people think. And we're going to talk a little bit about how it goes beyond that. It can affect bronchoconstriction because it's trying to close those lungs up so things can't get in our airways. And it actually purposefully causes inflammation. So we want our immune cells to be able to rush to that site. So it increases your vascular permeability and your blood flow, and it actually allows the rest of other immune cells to get to the site of the invader. Now, that's great when we have an acute response. That's the point. The problem that starts to happen is when we are getting constant inflammation. We're really never able to turn this down. So we start to get, as long as histamine's in balance, like we said, it has purpose, but we start to see a problem when we get an histamine overload. And so I like to use a bathtub analogy for this, or a sink analogy. So if you are pouring water into a bathtub and the drain is open, you're always going to have an even flow. You're going to have this balance and you're never going to overflow the bathtub. So what starts to happen, one of 2 things happen. You either plug the bathtub and you keep the water on, or you turn up that water, or both start to happen. And what we start to see is this overflow where we're seeing symptoms. And because we have 4 different types of histamine receptors in our body, we're seeing a wide variety of symptoms. So we can see those typical allergy symptoms, like we're saying, like the nasal congestion, the sneezing, the asthma, the rashes, the hives, things like that. But we also can see headaches and migraines. Histamine is huge for migraines. I've worked with hundreds of women with headaches and migraines, and there is a huge component there. Fatigue. There's a lot of mast cells in our gastrointestinal system. So think of mast cells really lining the skin, the GI system, like the surface areas. So we have a lot of gastrointestinal issues. We have fatigue, palpitations, dizziness, anxiety. We can see irregular periods, PMS, flushing, joint pain, sleep disturbances, vertigo. So they're, all over.
Everything.
Yeah. So it's really all over. So what we need to do is we need to look at both of those things. So we need to say, okay, how are we breaking down histamine and what's turning the water up? So histamine's broken down in 2 different pathways. We have diamine oxidase, which breaks it down in your GI system. So we eat foods that contain histamine. The diamine oxidase is an enzyme that helps break it down. So think of it like lactase. So if you have a lactose intolerant, you're someone whose lactase enzymes don't work well, you can't digest dairy. This is similar for histamine. We need to break it down. Then we also need to break it down intracellular in our cells, and we do that by something called histamine N-methyltransferase. So you have to be able to methylate also in order to break histamine down in your cells. Now, a lot of people have heard of the MTHFR genetic variant. That's become really popular. We're learning more about that. And we think about 2/3 of the people in the United States have a variant there. It's not the end of the world. We can do things to get around that. Some people are like, I have the MTHFR. And you're like, yeah, there's just, we just have to work on what to do. But that's common. And so if you have that variant, you might not be methylating. So if you're taking folic acid, or you're just eating a lot of things with folic acid, you're not able to use that folate the same way if you have that variant. So we need to make sure that you're getting methylated folate. So we need to rev up the metabolism of, make sure you're methylating. Another problem I see there, sometimes it's a whole pathway. So even if we rev up, if you're like, okay, I was told I have MTHFR, I'm taking a methylated B, I'm doing those things. Sometimes when we rev the pathway up, we put the gas on, but there's a clog further down, we still are not breaking it down well. So you really have to look at that kind of whole process of how you actually break down histamine. So we need to have the ability to break histamine down. So that's kind of the one bucket. And then the other thing is what's turning the water up. So why are your mast cells releasing histamine? So we see things like, we'll dive a little bit more into gut health, but we now know there are specific histamine producing and mast cell activating microbes that can just be on their own producing histamine. We know, environmental things. So what's your environment look like? Infections, viruses, hormone imbalances. There's all these things that are, really turning the gas up and saying, okay, we're really putting more water in that bathtub and we're not able to break it down. So we just need to make sure that we have this flow, this balance. And when we bring our body back into balance, we see a lot of these symptoms clear up.
So much great information. I have a lot of questions.
Sure.
So, couple things. One, like, are we putting more histamine in our body too through certain foods? Like, are there certain foods that should be like red flags that if we're having too much of these? And then also, and these are probably both kind of big topics, so you choose how you want to answer them. But also, you mentioned a lot of symptoms that I think a lot of people have. And so, in the age of information, like, if I'm someone who has anxiety or a lot of congestion or I mean, really anything you named, like how do we start to know that histamine might be one of the things we want to start looking at?
Hey, we'll get right back to the show. But first, I want to ask you, are you craving deeper connection, but feel like life is just too chaotic to actually make it happen? This is why I created the Beehive. And trust me, this is the community you didn't know you needed. The Beehive is all about helping you grow, connect, and thrive without adding more to your already full plate. In here, we tackle personal growth together with fun challenges, journaling prompts, and heart-centered support from women who get it. This is like having a cheer squad, a soul tribe, and a growth roadmap all in one. And here's the best part. This community is less than what you would spend on a couple of fancy coffees each month. So imagine simply trading a latte or two for life-changing connection, tools, and growth. So if you're ready to feel aligned, inspired, and truly supported, come join us in the Beehive. Check the Beehive link in description. We would love to see you there. Now back to the show.
So one of the things, so let's dive into food. So one of the things that you can do that, we do a lot of testing. Come to me and I'll help you
Absolutely.
identify it.
We'll link
but
it. Yeah.
if you don't,
That's
if you
but
can't, yeah.
that's where I think just to pivot off that or to piggyback on that, testing is what helps like get rid of the overwhelm because it's like I don't even know where to aim and shoot anymore. There's so many resources out there. Where do I start? Testing is where you get those answers.
Mm-hmm.
And then it's like, I don't feel great. I know exactly what's going on. And now I know exactly what to do. I'm a huge fan of testing. So we will link your information for sure.
Oh yeah, thank you. Yes, but what you can do to just get started, if you want to have a place to get started and see, okay, what will this make a difference? Is one of the things we can use as a tool is a low histamine diet. Now, I do when I talk about the low histamine diet, really want to preface that this is not the end all be all. You do not actually want to live on a low histamine diet forever because there's a couple different things. There's a lot of good foods on this diet. So there's a lot of nutritional values like tomatoes and strawberries. We can get into some of them, avocados. There's good things. So we don't want to eliminate these forever. And what I see happen is if people get stuck on this low histamine diet, we start to react to more and more foods sometimes. So you pull foods out, and then it's harder to get them back in. So we're using this as a short-term tool while we're actually addressing why this is happening in your body. So it is. So, but you can use it as a tool. So if you're saying, okay, do I have an inability to break down histamine? Eating histamine foods, does that make a difference? You can try to say, okay, let's take 2 or 3 weeks, pull these foods out and see, do some of my symptoms clear up? That can be a useful tool. So we're thinking of foods that are fermented foods are high in histamine. And this is where it's very tricky. So when it's like this cycle that starts to happen, like a lot of other things. Gut health So when we're looking at histamine intolerance, we're looking at gut health. So we know they're histamine producing, and I'm kind of taking a wide answer to this, but I want to kind of come back to why I'm doing it. So when we're looking at gut health, we know that we need to be able to break down histamine with diamine oxidase. Diamine oxidase lives in the brush border of our gastrointestinal lining. So we need to have a healthy mucin layer. We need to have healthy enzymes there. But, and we know that there are like histamine producing mast cell activating microbes. So we need to work on your gut health to be able to process histamine. A lot of the gut healing protocols that are out there right now include high histamine producing things. So
They
we're
do.
looking at fermented foods, we're looking
Yeah.
at bone broth, we're looking
Yeah.
at probiotics. So it backfires for a lot of people. And
You
that's
literally read,
one of the
you literally
problems.
read, you read my mind. I'm like,
Mhm.
these poor women trying to do everything
Yep.
right. And now it's like, wait, the stuff that I'm doing for my gut. Yes.
Is not right for you right now. So, and I always say like, it's not that it's not always right for you, but it's not right for you right now. And
If
so
you're having high
histamine.
histamine.
Uh-huh. And so
Okay.
that's where it's tricky because you're looking for answers. You're like, I'm going to heal my gut. And then you're doing things that are actually promoting you to potentially react more. So we have to do gut healing in a different way when we're looking at it from this perspective. So I wanted to just kind of point that out. Now, when we're looking at a low histamine diet, we're looking at, like I said, things like fermented foods like aged cheeses, it's like the sauerkraut, things like that. Then we're also looking at, you can have foods that liberate histamine. So that's when we're getting into things like strawberries, tomatoes, think foods like that. We have foods that actually affect the breakdown of diamine oxidase. So that would be even like tea or something that does that. So I have a whole guide. It's called the Essential Guide to Histamine Intolerance, and I can link that. And that gives a lot of foods. It's like 25-page resource that you can really go through and see what foods you can eat, what foods you can't eat. It's detailed because a lot of the information surrounding this diet out there is inaccurate. So, everyone can download that. It's just go.megmill.com/histamine. So
Okay.
that's
We'll link
that's
it
more of a
too.
complete guide. And then the other thing that you have to think about when you're looking at food here is freshness. Because even if you're eating low histamine foods, if you cook foods, it can actually grow histamine. So you may be cooking something and it's low histamine, but it's in the refrigerator for 2 days. You eat it as a leftover, and you can even react to leftovers. So it's tricky. So
No.
meal preppers have trouble. Mm-hmm.
Yes. I'm
Yeah.
literally thinking about the things I made Sunday for
Mm-hmm.
getting ahead for the week. Oh my God.
Yes.
So what do we do? This is
So
so important.
I know.
And
I
I know
know.
you're going to give us really easy tips because I'm like, wait,
I
we
know
want to
it's
do
hard.
what's right. Yeah.
Yeah, because you're thinking, okay, I'm busy. I'm a busy mom maybe, and I want to have everything ready. And then you're cooking on Sunday, and then you're like, okay, now I have food sitting there. So what I actually recommend is flash freezing. So you can still meal prep, but just maybe take it in portions and flash freeze it. And that way you can just bring it out when you're ready to eat it. So we do a lot of that when we're working with histamine.
What is flash freeze as opposed to
Oh,
freeze?
yeah.
I don't know what
Well,
that means.
freeze. Like, yeah, just freeze it. Yeah,
Just
that's
freeze.
yeah,
So
yeah,
like right
yeah.
when you're done
Yeah.
cooking
Right
before
when
you
you're
put it
done
in the fridge.
cooking.
Okay. Got it.
Yes. Yep. Just freeze it and then pull it out when you're ready to eat. And so say, okay, maybe I don't eat leftovers after, really after 24 hours, you want to watch leftovers. You also want to watch going out to dinner because you don't know when that was prepped. You don't know when the
Yeah.
meat was cooked, so sometimes you can get hidden triggers when you're going out to dinner that can be tricky. So sometimes I have a supplement called Histadigest, and it's a diamine oxidase enzyme. So sometimes what we'll do is take a diamine oxidase enzyme when you're eating that food. If you're going to have a high histamine food, you're going to be at a party, you're going to be out to dinner, then you take that so that you can help break down the histamine a little better.
Great. Let's definitely make sure we get the link to that because I love those kinds of things. I call them the insurance, right? So
Mm-hmm.
there's like the information and there's what we strive to do. And then there's like when life gets a little bit lifey. So just to
Yes.
have
Yeah.
something, if you're like, oops, yesterday's leftovers are going to be tonight's dinner. I didn't freeze, or I'm going out to dinner because it's really good for my soul, which is good for
Mm-hmm.
my health. Just one question back about the food. If we freeze it, you said unfreeze it right before you eat it. Like, could I unfreeze it that morning for
Yes. Yeah.
dinner?
That
Okay.
day.
Like
I
that
would do
day.
same
Okay.
day. Mm-hmm. Yes.
Perfect.
Same day. Mm-hmm.
All right. And we'll link that enzyme that you just brought up. That's great.
Yeah, because that way you're right. Life happens and you need sometimes it is pretty strict. And that's why I'm like, okay, it's never the end all be all. It's just a tool. And so many things are tools. Let's investigate. Let's see what your connections are. Sometimes once we really dial into food, I mean, I like a side note here is every time you put food in your body, you're making a choice. And so you're either serving your body or you're giving your body something it doesn't understand. If we look at how we feel after we eat and we actually pay attention to that, you can find clues. So you can start to find patterns of, oh, you know what? Every time I eat strawberries, yeah, strawberries are healthy food, but every time after I eat strawberries, I'm getting a migraine, or, I'm more itchy, or my nose starts to run a little bit, or my stomach's upset. Or sometimes we start to look at these patterns for people, and it's really great information that's free. You can just start doing it. And you don't have to write down everything that you eat all the time, but really start to write down things. If you're having symptoms, what have you eaten before that point?
I love that. I have some questions on that. So, you mentioned you can write it down. So, what are the kinds of things that someone would experience and about how long of a window after? Right? So, is it like your breakfast
Yeah.
food and then you have a headache when you go to bed, would you still count that food? What's like the
Yeah.
timeline?
I would say 24 hours. So
So,
I would,
anytime
yeah.
within that day, it's like whatever
Mhm.
you're eating in that
And
day.
that's
Okay.
tricky. So, when we're looking at food sensitivities, you can have a food sensitivity too, which is an immune response to a food. That can happen 24 to 48 hours after you eat the food. So that's where it does get a little bit tricky because it could be the food you ate yesterday that you're responding to today. And so it's not always what you just ate. So that's where I would say, okay, if you have symptoms, and this could be anything from that we listed, what are your unique, there's often a unique combination. So you're not always like, some people just have insomnia and it's histamine. Some people have anxiety. It's really, when you're digging into this, very unique. So I think that's where it's like, okay, it's not just allergies. It's not just, okay, I feel like I have allergic symptoms. It's like gastrointestinal issues. It can be anxiety. It can be migraines. It can be all of these different things. So if you're having any symptoms, you know what yours are, then write down what you ate for the past 24 hours
I think
and
this
start
is
to look
really
at it.
interesting and a really important concept because, if the listeners would just like zoom out for a minute, I think one of the really big take home messages is to come from a place of knowing that our bodies are not designed to decline as we age.
Mhm.
Right? When you and I first hopped on before this and you were telling me like how old your kids are, and I was blown away. Like you look half of your age. And, in the functional medicine space or in the national natural practitioner space, we have a knowing that like these signs of typical aging are not signs of typical aging. They're signs of our health declining. And it's because of something that we're doing too much of or not enough of. And so what I'm hearing, and let me know if this makes sense to you or if you agree, is just to start to like take a pulse on these symptoms. So we don't have to overcomplicate it. It's just starting to understand that like if you feel foggy in your brain, there's probably something that you put in your body that contributes to that. So like I know for me, if I eat corn, like corn chips, if we go out for Mexican food, later in the day, I'm going to find myself like kind of staring, kind of like
Mhm.
a little foggy, a little tired. Like I know it's the corn chips. And so as we start to like find these patterns, it becomes really empowering because you may decide to still have the corn chips or the gluten or the fermented food, but like in that, you're no longer a victim to how you feel. You understand that you have control of your health. And your role as the listener is just to start to identify patterns and see if this fits you. You don't need to figure it all out. That's what people like Dr. Meg are for. Like you then go to someone who's the expert and you're like, here's the patterns I'm noticing. Is there something here? Can you figure it out? And can you tell me exactly what to do? Do you feel like, is that
Yeah,
accurate? Just
it's
so we can kind of like, it's not their job to figure out every piece. You would do that.
yes. Yeah, I agree. There's so much information out there right now, and it's hard to navigate because you're listening to podcasts, you're out there seeking, and I love that. I love that everyone's out there seeking. It's amazing. But I do often get messages then from people like, oh, I heard this. I need to try it. Do I need to do this? Do I need? And you're like, that might be right. Just because something's right for someone else doesn't mean it's right for you, and it doesn't mean it's right for you right now. So
Yeah.
you have to find out, listen to your body, exactly what you're saying, find out how you feel, how you respond to things, and then find someone who can guide you to the exact things you need to do to actually get the results that you're looking for.
Yeah, love that. Thank you. Okay, I have questions on hormones, but I just want to make sure, is there anything else you want to bring up in regards to what we were just talking about with
Yeah, we can
histamines
jump
and
into
gut?
yeah, we can jump into hormones.
Okay, I've seen a ton of beautiful content on your gram. On the gram, if anyone's on Instagram, go check her out because it's just
That
fun, like graphics of symptoms you might be having. Or this is where Instagram's really fun. It's like you can
Mhm,
dabble and play. Talk to me about hormones. There's a lot of really great information on your socials on hormones. So
mhm. So
tell me where you're at with that.
yeah. So when you're thinking about like, we'll pull the histamine connection in first, because this is something I think that no one else is really saying well. So I want you to hear this. So our hormones fluctuate through the month. So we're going to have, I know you probably had many people on here saying the hormonal pattern. So we're getting to know those. We have different phases of your cycle. And so you're going to have different hormone levels at different times of the month. And estrogen actually has receptors on mast cells. So estrogen's telling the body to release histamine. And it will say, okay, mast cell degranulate, release histamine. And you can get actually when you have estrogen dominance, you can have increased symptoms of histamine intolerance. Progesterone puts the brakes on histamine. So progesterone helps with DAO. It helps break down histamine. It helps lower histamine. So we're seeing different symptoms in different times of the month. So that's why some people can say, let's use a glass of wine, for example. So some people can say, if I drink a glass of wine, sometimes I have a migraine. If I drink it at other times, I don't have a migraine. So it's not the wine. Well, we're looking at the body at overall levels in the body. So we're thinking, okay, what's stacking up? What's the next thing that's stacking up? What's the next thing that's stacking up? If you're in your luteal phase, and your estrogen's higher and maybe you're stressed out and your progesterone's low, or you're starting perimenopause and your progesterone's low and your estrogen dominant, you're going to be more likely to have symptoms at that time because you're releasing the histamine and you're not putting the brakes on it with progesterone. So there's all these cycles in the body, and sometimes one like perpetuates another that perpetuates another. So we get in this cyclical problem, and it's hard where do you start? That's the thing. You need to almost start two-pronged. So I think that's like another thing is your body's always changing. A lot of these symptoms maybe you didn't have younger. You hear, okay, but why could I eat anything younger? Why was I not having any of these symptoms? Well, your hormones were better balanced. Maybe you didn't have underlying microbes in your gut that were causing some of these. You have things that happen through life. Stress is another thing that can be a proponent. So all these things build up and the symptoms start, but it's all the other things that are going on in your body that are affecting it.
Yeah, like the stack. That makes sense.
Mm-hmm.
There's certain
Exactly.
times of the month that what I'm hearing is there's certain times of the month where we're going to be more susceptible to maybe the sauerkrauts or the kombuchas or the bone broths or the glass of wine. So that can be really powerful also in figuring out those patterns. If histamine is the trigger, then when estrogen is high, we're going to be more reactive,
So when estrogen, so you're going to look at your luteal phase. So
which is
often like right before your period, and then another time is ovulation because estrogen's going to spike and fall in ovulation. So those are the two times of the month that we're more likely to see the reaction. We're going to be more likely to see this in perimenopause because in perimenopause we get this natural imbalance of estrogen and progesterone in a lot of women because progesterone's going to drop before estrogen. So generally we're going to have a drop in progesterone years sometimes before we see. Another thing in perimenopause is estrogen becomes erratic. So sometimes it's high, sometimes it's low. We start to see this erratic release of estrogen until it finally goes away. So that's why a lot of these symptoms are just become a lot more difficult to understand and manage. So really when we're looking at hormones, it's all about balance. So don't let anyone tell you that, okay, there's nothing, okay, your hormones are just out of whack, or we just need to put you on birth control or whatever. You just need to create balance. You need to look at your own unique hormones and bring them back into balance. I have to say, I get a little bit nervous of the people out there promoting supplements and things like that for hormones, because you can actually get yourself into like more dysregulated if you just start taking like, let's say you just start taking DIM. So DIM's something that will lower estrogen. It's going to shift your metabolism of estrogen to your CYP1A1 pathway. That's where we want it. So when you think of estrogen, you want to use it and lose it. So you want to have enough, you want to lose it, it's gone. And that's how we metabolize it. But if you do that, you may not actually have an overall high level of estrogen. You may just have, a decreased level of progesterone. There's a lot of different imbalances when it comes to hormones. And when you just take hormone supplements without really looking at your unique picture, you can sometimes make it worse. And, it's tricky there, I think, for people.
Yeah, interesting. So do you advise your clients that you work with to not, or is it like the balance of it?
I would say be careful of hormonal supplements unless you test your hormones.
Okay.
So you want to
And
test.
what kind
Test,
of
don't
testing?
guess with hormones.
Test, don't guess. What testing do you use? I'm just curious.
I prefer Dutch testing.
Dutch.
That's my personal choice. I have used other tests. I do sometimes, but my personal choice is Dutch test. And the reason is because you can see the metabolites of hormones. So when we're looking at estrogen, so when you're going to look at, if you get a blood draw of estrogen, they're going to look at your E2 mostly. So that's your estradiol. That's our most prominent form of estrogen. And what I see often with women is that sometimes your estradiol will be normal or even low, but you have higher metabolites. So basically, when I say you need to use it and lose it, you need it, but you need it to be able to be removed from your body. And sometimes we're stuck in these places where we can't remove it. So you don't maybe have high estradiol, but you have high metabolites, and you can look like you have a low estrogen picture when you really are struggling from estrogen dominant type symptoms because of the way you're metabolizing it.
Ah, so interesting. I want you to do my Dutch test. Let's do a Dutch test. I'm
Yeah,
so curious. And maybe we literally
we
film
could
a
do a podcast on the Dutch
on
test.
that.
Yeah.
Yeah, like I would be an open book. Maybe
Uh-huh.
we do like a bonus episode, like read me my Dutch test. I mean, I think, you and I were talking about at the beginning, like we win as women when we start to collaborate and connect in deeper ways. And to me, this is part of that. Like, all right, my audience listening, like this is interesting to you. I'll be the guinea pig. Like, test my hormones. I always want to know what's going on. I just ran a heavy metal test.
Okay.
Like, I'm not going to accept these symptoms when I have symptoms of, a little bit more headaches or just a little bit more hormone fluctuations. My stress has gotten a little higher. I'm doing a lot more, as we were talking about with career. But like, I will never look at declining health or like variance in your health as just what's meant to happen.
Yes.
Like perimenopause, I think we're all hearing like these horrible symptoms that we all might experience. But what I hear in what you just said is like, maybe it's histamine.
Yeah. And you
Maybe
don't
it's
have to.
toxins.
You don't have to experience them. And that's, I think, like a good message. Like if you take that away, you don't have to experience the symptoms. You just have to create balance in your body. So how do we bring your body back into balance in order for your symptoms to clear up? Because like we were saying, symptoms are signs. They're signs of some sort of imbalance, some sort of inflammation going on. And if you listen to those and you don't accept that, like you're fine, you're just busy, you're
Right.
aging, you're tired, all those be you think, okay, be your own health detective, find a guide that you trust and look at those imbalances and say, okay, what do I need to do? You're going to feel better.
Yeah. Oh, I love that. That's so empowering. Okay. We're going to run a test and we're going to share it. We're going to do this. Fascinating. Okay. Are there more tips on how we calm histamine if we know this is one of our triggers, or maybe are there things we can do? Like say we have a glass of wine occasionally and it doesn't feel great and maybe histamine is to blame. Like, is there something we can do around that? We're going to have a drink with our girlfriends and we don't want to have the headache.
Yeah. So I would say like take the diamine oxidase enzymes to help break it down. So that's, the one thing. So we can also look at what do we need to do to stabilize your mast cells. So there's supplements like quercetin is a good one. There's different things that you can take in order to stabilize the mast cells to help process histamine. So that would be a thing. Ultimately we need to go back and say, why is your immune system responding? So, it comes down to what is the root cause, or generally root causes that are making you more responsive. And so a lot of it is, I would say one of the places I really start is gut health. So we look at your microbiome. We say, okay, do you have good commensal bacteria? Do you have a good mucin layer that you can actually break down the things that you need to break down? How is your immune response? Do you have these histamine or mast cell activating microbes? Do you have candida? Do you have a parasite? Do you have other H. pylori, other things that are going on for your body to feel unsafe? So when we look at stress, when we're living in this fight or flight and we're looking at stress, stress is psychological. It's like emotional stress, but there's also a biological, physiological component to stress. So, when you have some of these things going on underlying, your body's in a fight or flight mode, it is stress, and your immune system's like, hey, I'm activated because I have a parasite, or I'm activated because I have these specific microbes, and you don't even know they're there. No one is going to look for them for you unless you go to someone that's a functional practitioner, and they might be the reason behind all of this. So I think it's really looking at what is causing it in order to bring it down.
Definitely. I totally agree. Yeah, I think it's always getting to the root cause rather than trying to put a Band-Aid on a bullet wound.
Mm-hmm.
Like it's getting to the deeper level. So thank you. I feel like you gave us great ways to get to that root cause, some things that we can consider that help take the edge off. I want to ask and talk about stomach acid. Is
Uh-huh.
that okay
Sure.
to go there? Anything
Yes.
else on hormones?
Mm-hmm. Yep.
So I think the general population is bombarded with information, or at least hears enough of it, that stomach acid is bad
Mm-hmm.
and that we need to lower it, right? You look at Tums. I don't know if there's anyone out there around our age that doesn't know what Tums
Yeah,
is,
yeah, I know.
which is really interesting
You
when
got it.
when we
Yeah.
break down what Tums is and does, that Tums comes with calcium in it. And I know
Yes.
you know what I mean.
Mm-hmm.
You
Yes.
can't
Uh-huh.
use it.
Uh-huh.
So let's talk about the beauty of stomach acid and why it's important, and maybe what someone can do if they're having like stomach acid symptoms so that they're not decreasing their stomach acid to cover symptoms of the root cause of another problem.
Yes, Tums, we're seeing, omeprazole, which is, we're seeing like the Prilosec, those they're called PPIs, proton pump inhibitors. I mean, they're just handed out. So if you go and you say, I have heartburn, or I have something, they're just gonna be like, here, let's put you on a PPI. Well, the problem is once you get on these medications, it's very hard to come off of them because you're gonna get rebound reflux. And so you have to wean off of them very slowly and methodically and really understand what you're doing. And so it's a slippery slope when we're just starting to take them, because we can get stuck in this cycle and feel like every time I try to go off, it comes back. Well, that's just your body responding to the withdrawal of the medication. So we need stomach acid to break down our foods. So when you have reflux, you're feeling stomach acid in your esophagus. The stomach acid isn't really a problem. It's that you're feeling it in the wrong place. So the esophagus tissue is different than the tissue in your stomach. And that's uncomfortable because, yeah, it's not supposed to be in your esophagus. What they found, these medications, the proton pump inhibitors, were actually developed to help ulcers while you're treating a stomach ulcer. And they found out when they were doing that, like, oh, people were having less reflux. So then they just started, looking to use them for reflux all the time. And it just became this thing. But we need to be able to break down our stomach acid, break down our food. And stomach acid helps us to do that. Now, if you're lowering your stomach acid, you're not breaking your food down as well. And what's going to happen there is your food is going to go into your small intestine in bigger particles than intended. That causes more microbes to be able to feed on that food. So when we're talking about these microbial overgrowth, we're seeing more and more of them because your food's down in the small intestine where it shouldn't be. And so it's like has more to feed on. So then we can get in this cycle. Once you get more microbes, they also leave off gases when they're feeding, hydrogen and methane gases. Those gases can cause a lot of GI symptoms, and they can also cause air pressure to actually push up that sphincter, the LAS sphincter that causes the reflux. So you have all these cycles. So it's one of those things that, like, okay, now we're in this other cycle here where we're changing things. So you really need to increase your stomach acid a lot of the time rather than decrease it. But you have to just be careful. Like if you're listening to this and you're already on one of those medications, It is advised to go very slowly. We do a long taper usually when we're trying to stop that because we don't want to have rebound reflux either. It's not comfortable and it's not something you will want to go through. You'll just want to go right back on the medication.
It's really interesting. A lot of this would be, I mean, you know this with your background in pharmacy, drugs and medicines look at fixing one
Mhm.
problem.
Yes.
Like, do they work? It depends on the question you're asking. And
Mhm.
drugs and medicine, I don't even like to call them medicine. Drugs look at one question and negate the rest,
Mhm.
right? So,
Yes.
does it limit stomach acid? Yes.
Mhm.
But does it do all these other horrible things? 100%. So instead of taking this limited scope of, I have this wrong with me, let me treat it with this is where functional medicine is so beautiful and interesting because it's looking at the whole body and the whole picture and how every system plays together.
Mhm.
It's like the elbow bone's connected to the shoulder bone is one of the best songs. Like you can't,
Yes.
it's like when you have a knee specialist who's not looking at the hip and the muscles crossing the hip attached to the knee. Like, how can we look at this one thing? It's going to cause more damage when we don't look at the whole picture. So, so important. Now, I know there's an important correlation between our stomach acid and our feel good neurotransmitters.
Yes. So yeah, so we're gonna go in the gut brain connection. So
Yes.
yeah, so you have different types of nervous systems in your body, and one of the nervous systems is your enteric nervous system. So we have trillions of neurons in our gut, and we have the vagus nerve, which is going to go from our gut to our brain, and it's a superhighway. So it's traveling back and forth. Your brain is sending messages, to your gut, and your gut sending messages to your brain, just to simplify. And it's telling your body, okay, how do I digest? How do I release stomach acid? And then when we have different things, imbalances going on in our gut, it's saying, okay, we have an immune response, we have cytokines, we have things that, and it's sending a danger message back to the brain, which can inhibit, when you think of the cycle. So your brain, when you need to digest, your brain is saying, release stomach acid, release bile from your gallbladder, release enzymes from your pancreas. It's giving signals of what to do. And so when we're saying, okay, I'm in danger, I have problems, it's also giving signals to say, don't do that. You're running from the lion right now. You don't need to be digesting. And so we can get it stuck in this cycle too. So, I like to work at things through, we're looking at the testing, we're looking at bringing everything back into balance with, digestion, with hormones, with all of these things. But I also do nervous system work with everyone I work with, because we also need to bring your body back into that parasympathetic nervous system. We need to teach you how to regulate your body. And you and I have discussed some of those things. And I know that's what you work on with people too, is how do we bring ourselves back into that parasympathetic state, in that calm state, no matter what's going on, and learn some regulation in order to keep ourselves in that place?
So is there a correlation between like a symptom like anxiety specifically
Mhm.
and like gut health or even stomach acid tying into that?
Yes, there's so many processes. So there, it's more signals. It's not so like a lot of people are out there saying, 90% of your serotonin is made in the gut. That
Yes,
is
that's what I'm
true.
asking.
Yeah, okay, that is true. But that serotonin in the gut is primarily for motility purposes. So
Mm.
there's a little bit of difference between serotonin made in your gut and serotonin made in your brain. So the emotional part, the mental emotional part is more from signaling. It's from, like we were talking about, some of the signals that you can get a leaky blood-brain barrier, you can have things like that. And there's more signaling rather than that direct correlation generally with serotonin, because the serotonin in your gut's generally more for motility.
Got it. Beautiful. Okay.
Mhm.
So much information, so many resources. If a woman is listening to this and is curious to maybe see if histamine is part of what's contributing to her symptoms, where does she begin?
Yeah. So I think just going, on the taking a few weeks, go through the essential guide to histamine intolerance that we talked about. Take a few weeks, pull some of the high histamine foods out, see if that's a place to see if it makes any difference. That's one thing you can do that's free. And then I would say find someone who can talk to you about what are the exact things you need to do. What are some testing that would be good for your unique combination of symptoms?
Beautiful. Okay, well, we're going to link all your freebies. Tell us about the other ones. So you've got the Histamine Essential Guide to Histamine
Mhm.
Intolerance, and you've got a couple others.
Yeah, so I have a hormone checklist too. So you can go in and see, there's a lot of different, we talked about a lot of different hormonal imbalance. We didn't even get into, there's testosterone, there's cortisol, like a lot of different things, even that we weren't able to get into today. So I do have a hormone guide to see like, okay, what are your imbalances and what do you need to do about them? So that's at hormonefixer.com and you'll link that one. So yeah, check that out. I'm also over on Instagram at Dr. Meg Mill. So I'm over sharing information there. And I have a podcast called A Little Bit Healthier. So I am over there talking every day about tips we can do, simple, easy tips that you can do to be healthier every day. So come check us out, and I'd love to, get to know you. I do answer questions. I love helping people. I'm just on a mission to realize that every day you have the power to be a little bit healthier.
I love it. It's exactly what we need as women. Simple, easy tools. Meg, thank you so much. Dr. Mill, so excited and happy to have you, and very much looking forward to my audience hearing this information. Any questions you guys have, put them in the comments, email them. Let's get them answered. Let's create this discussion and conversation. This is such an important topic. Thank you so much for being here.
Thank you for having me.